In this podcast episode, renowned psychiatrist Dr. Bessel Kolk shares his extensive knowledge on trauma, its effects on the body and mind, and innovative therapeutic approaches to healing. With over 40 years of experience in the field, Dr. Kolk has revolutionized our understanding of trauma and its impact on individuals. This discussion covers a wide range of topics, from the nature of trauma to the efficacy of eye movement desensitization and reprocessing, EMDR therapy, and the importance of community in healing. Dr. Kolk begins by defining trauma as an overwhelming experience that leaves individuals feeling helpless. He emphasizes that trauma is not merely a memory, but a visceral experience that can manifest in the body. This understanding is crucial because it shifts the focus from cognitive processing to the physical sensations and emotional responses that accompany traumatic experiences. He explains that trauma can lead to a breakdown in the connection between individuals and their surroundings, resulting in feelings of isolation and disconnection. The impact of trauma is profound and can affect various aspects of a person's life, including their relationships, mental health, and overall well-being. Dr. Kolk notes that many people carry the weight of their traumatic experiences without realizing it, leading to a range of psychological disorders such as PTSD, anxiety, and depression. By recognizing trauma as a lived experience rather than just a memory, individuals can begin to understand the depth of its effects and the importance of addressing it holistically. One of the key therapeutic approaches discussed is EMDR, which stands for eye movement desensitization and reprocessing. Dr. Kolk explains that EMDR involves moving the eyes back and forth while recalling a traumatic experience, which helps the brain process the memory differently. This technique allows individuals to reframe their traumatic experiences, enabling them to recognize that these events belong to the past rather than the present. The effectiveness of EMDR is supported by research, with studies showing that a significant percentage of individuals who undergo this therapy experience substantial relief from their symptoms. Dr. Kolk shares that in their research, 78% of participants with adult trauma reported being completely cured after EMDR treatment. This statistic highlights the potential of EMDR as a powerful tool for healing trauma and underscores the importance of exploring innovative therapeutic methods. Dr. Kolk reveals that a staggering 90% of the individuals he treats in his practice have experienced childhood trauma. He emphasizes that early childhood experiences shape who we are and how we navigate the world. The effects of childhood trauma can be long-lasting, often manifesting in adulthood as various psychological issues. He argues that addressing these early experiences is crucial for effective healing. The conversation delves into the concept of small T trauma versus big T trauma. While big T trauma refers to significant events such as abuse or violence, small T trauma encompasses the more subtle experiences of neglect or emotional unavailability. Dr. Kolk stresses that both types of trauma can have profound effects on an individual's mental health and well-being. Understanding the nuances of trauma is essential for developing effective treatment strategies. A recurring theme in Dr. Kolk's work is the significance of connection and community in healing from trauma. He argues that trauma often leads to a breakdown in relationships, making it essential for individuals to rebuild connections with themselves and others. He highlights the importance of social support and the role of community in fostering resilience and recovery. Dr. Kolk shares that many of his patients find healing through group therapy, where they can share their experiences and connect with others who have faced similar challenges. This sense of belonging and understanding can be incredibly powerful in the healing process. He emphasizes that creating safe spaces for individuals to express themselves and connect with others is vital for overcoming the effects of trauma. The discussion also touches on the neurological aspects of trauma and how it affects the brain. Dr. Kolk explains that trauma can lead to changes in brain structure and function, particularly in areas responsible for emotional regulation and memory processing. He describes how neuroimaging studies have shown that individuals reliving their trauma often experience a shutdown of cognitive functions, leaving them in a state of heightened emotional distress. This understanding of the brain's response to trauma underscores the importance of addressing both the psychological and physiological aspects of healing. Dr. van der Kolk advocates for a holistic approach that incorporates various therapeutic modalities, including EMDR, yoga, and bodywork, to help individuals reconnect with their bodies and emotions. By addressing the brain's response to trauma, individuals can begin to heal and regain a sense of agency in their lives. Dr. van der Kolk emphasizes the importance of bodywork and movement in the healing process. He discusses how trauma can lead to a disconnection from the body, resulting in feelings of numbness or hypersensitivity. Engaging in physical activities such as yoga, martial arts, or dance can help individuals reconnect with their bodies and release pent-up emotions. He shares his experiences with yoga as a therapeutic tool for trauma recovery, noting that it can help individuals develop a greater awareness of their bodies and emotions. Through movement, individuals can learn to express themselves and process their experiences in a safe and supportive environment. Dr. van der Kolk believes that incorporating body-based therapies into treatment plans is essential for addressing the physical manifestations of trauma. The conversation shifts to the emerging field of psychedelic therapy, which Dr. van der Kolk views as a revolutionary approach to treating trauma. He discusses the potential of substances like MDMA and psilocybin to facilitate profound healing experiences. These substances can help individuals access deep emotional states and gain insights into their trauma, often leading to significant shifts in perspective. Dr. van der Kolk highlights the importance of conducting psychedelic therapy in a safe and supportive environment, with trained professionals guiding the process. He shares that many participants in psychedelic studies report feelings of self-compassion and connection to others, which are crucial for healing. The potential of psychedelics to open new pathways for understanding and processing trauma is an exciting development in the field of mental health. Throughout the discussion, Dr. van der Kolk critiques traditional treatment approaches that focus solely on cognitive restructuring or medication. He argues that these methods often fail to address the underlying issues related to trauma and can leave individuals feeling stuck. Instead, he advocates for a more integrative approach that considers the whole person, including their physical, emotional, and social needs. He expresses concern that the current mental health system prioritizes productivity and financial success over genuine healing. This focus can lead to a lack of attention to the individual needs of patients, resulting in inadequate treatment outcomes. Dr. van der Kolk calls for a shift in the mental health paradigm, emphasizing the need for more holistic and compassionate approaches to trauma recovery. A significant aspect of healing from trauma is developing self-compassion. Dr. van der Kolk discusses how many individuals who have experienced trauma struggle with feelings of shame and self-blame. He emphasizes the importance of cultivating a compassionate relationship with oneself as a crucial step in the healing process. Through therapeutic practices such as EMDR and psychedelic therapy, individuals can begin to reframe their experiences and develop a more compassionate understanding of themselves. Dr. van der Kolk believes that fostering self-compassion can lead to profound changes in how individuals perceive their trauma and their ability to move forward in life. Dr. van der Kolk reiterates the importance of community in the healing process. He believes that individuals who have experienced trauma benefit greatly from connecting with others who share similar experiences. This sense of belonging can provide a supportive environment for individuals to process their emotions and gain insights into their healing journey. He encourages individuals to seek out community resources, such as support groups or group therapy, where they can connect with others and share their stories. By fostering connections with others, individuals can begin to rebuild their sense of self and find strength in their shared experiences. As the conversation comes to a close, Dr. van der Kolk reflects on the future of trauma treatment. He expresses optimism about the growing recognition of the importance of addressing trauma in mental health care. With advancements in research and a greater understanding of the complexities of trauma, he believes that more effective and compassionate treatment options will become available. Dr. Kolk emphasizes the need for continued exploration and innovation in the field of trauma therapy. He encourages mental health professionals to embrace new approaches and consider the unique needs of each individual. By prioritizing holistic and integrative treatment methods, the mental health community can make significant strides in helping individuals heal from trauma.